Most men try pills that force temporary results, but there's a hidden spot on your body that rebuilds natural function instead. This spot isn't where you'd expect. It's not at the gym. Most men never think about it. Yet beneath this area lies the muscle, controlling whether you stay firm or fade quickly. When this muscle weakens, nothing else works. But 3 minutes of daily massage with pumpkin seed oil can fix it. I'm Dr. Elizabeth Rains, urologist. Today I'm revealing where the spot is, the exact technique, and why men report results that genuinely surprise them. Share your location and age in comments. I've created extensive content on male health after 40. Watch and subscribe. Let's begin. Let me explain exactly what muscle we're targeting and why it's so critical for maintaining firmness. The muscle is called the bulbospongiosus. It sits in your pelvic floor. The hammock-like layer of muscles that supports your pelvic organs and controls several critical functions. This specific muscle wraps around the base of your pelvic region and acts like a natural clamp during physical response. When it contracts properly, it traps blood where it needs to stay, creating and maintaining firmness. Think of it like a valve. When the valve is strong and responsive, blood flows in easily and stays trapped. Firmness is full and sustained. When the valve weakens, blood flows in but doesn't stay trapped. Firmness develops but fades quickly, leaving you frustrated and wondering what's wrong. As men age, this muscle naturally weakens if it's not actively maintained. Sitting for long hours, lack of physical activity, and chronic stress all contribute to this weakening. Most men have no idea this muscle even exists, let alone that it's responsible for their function problems. But here's the good news. This muscle responds incredibly well to targeted stimulation. Unlike some age-related changes that are difficult to reverse, pelvic floor muscle strength can be rebuilt relatively quickly with the right approach. The spot we're going to massage sits directly above this muscle. By applying pressure and movement to this area while delivering nutrients through the skin, we activate the muscle, improve its blood supply, and strengthen its function. This isn't theory. This is practical anatomy that produces measurable results when applied consistently. Now let me explain why pumpkin seed oil is uniquely effective for this technique. First, pumpkin seed oil is exceptionally rich in zinc. Zinc is essential for testosterone production, tissue repair, and nerve function throughout your pelvic region. Most men are deficient in zinc, especially after 50. When you apply zinc topically to the perineal area, absorption is direct and efficient. The skin here is thin and highly vascular, meaning it's packed with blood vessels ready to transport nutrients to surrounding tissues. Unlike oral zinc supplements that must survive digestion and compete with other nutrients for absorption, topical zinc enters your system within minutes and goes directly where it's needed. Second, pumpkin seed oil contains phytosterols, plant compounds that reduce inflammation and support healthy circulation. Inflammation restricts blood vessels and damages tissue responsiveness. By reducing inflammation at the source, phytosterols create an environment where natural function can return. Third, the oil provides essential fatty acids that maintain cell membrane flexibility. As we age, cellular membranes can become rigid, which slows every biological process, including nerve signaling and blood flow. By nourishing these membranes, you restore cellular responsiveness at the most fundamental level. Fourth, and this is critical, pumpkin seed oil has a molecular structure that allows deep tissue penetration. It doesn't just sit on the surface like many oils. It absorbs into the deeper layers where the bulbospongiosus muscle, pudendal nerve branches, and key blood vessels are located. This deep penetration is what makes the technique so effective. You're not just moisturizing skin. You're delivering therapeutic compounds directly to the anatomical structures that control function. Now, let me walk you through the exact massage technique so you can start tonight. Step 1. Gather what you need. You'll need high-quality cold-pressed pumpkin seed oil. Look for oil that's dark green with a rich, nutty aroma. This indicates it's unrefined and contains full nutrient content. You'll also want a private, comfortable space where you can relax without interruption. Step 2. Prepare the area. Make sure the perineal area is clean and dry. A warm shower beforehand is ideal as it opens pores and increases circulation. Step 3. Warm the oil. Pour about 1 teaspoon of pumpkin seed oil into your palm. Rub your hands together for 15 to 20 seconds to warm the oil. Warmth enhances absorption and makes the experience more comfortable. Step 4. Locate the spot. The perineum is the area between the base of your pelvic region and your anus. You can locate it by sitting comfortably and feeling for a slightly springy, muscular area. This is the bulbospongiosus muscle beneath the surface. Step 5. Apply the oil. Using your index and middle fingers, apply the warmed oil to the entire perineal area. Use enough that your fingers glide smoothly without creating friction. Step 6. The massage motion. Begin massaging using firm, slow, circular motions. You want pressure that's deep enough to feel the muscle beneath the skin, but not so hard that it causes discomfort. Imagine you're trying to activate the muscle, to wake it up and stimulate blood flow to the area. Continue these circular motions for 2 to 3 minutes, covering the entire perineal region. As you massage, you may notice warmth building. That's increased circulation. That's what you want. Some men also notice subtle tingling. That's nerve activation responding to both the physical stimulation and the nutrients being absorbed. Step 7. Breathe. While massaging, maintain slow, deep breathing. Shallow breathing creates tension. Deep breathing promotes relaxation and enhances circulation throughout your pelvic region. Step 8. Optional enhancement. After finishing the massage, you can place a warm, damp towel over the area for 10 to 15 minutes. The heat drives the oil deeper into tissues and amplifies the circulation benefits. This step is optional, but recommended when you have time. Step 9. Consistency. Practice this massage once daily, ideally in the evening. Evening is best because it allows nutrients to work overnight during your body's deepest repair phase. Consistency produces results. 3 minutes every evening creates far better outcomes than longer sessions done sporadically. Let me set realistic expectations about what you'll notice and when. Within the first few sessions, most men feel increased warmth and subtle pulsing in the area. This indicates improved blood flow and nerve activation. Within the first week, many men notice morning firmness returning or becoming more consistent. This is often the earliest visible sign that the technique is working. Your body's natural response mechanisms are reactivating. By 2 to 3 weeks of consistent daily practice, most men report that function during physical activity feels fuller, lasts longer, and happens more reliably. The anxiety that often accompanies performance concerns begins to fade because your body is responding automatically again. This happens because you're not forcing artificial results. You're rebuilding the foundation, strengthening the muscle, nourishing the nerves, improving circulation. These are permanent improvements, not temporary effects that disappear when you stop. Some men also notice additional benefits: better prostate comfort, improved bladder control, reduced nighttime urination. This makes sense because you're supporting the entire pelvic floor system, not just one isolated function. The key is patience and consistency. Your body didn't weaken overnight, and it won't rebuild overnight. But with steady daily practice, improvement is not only possible, but likely. To maximize results, combine this massage with complementary practices that support pelvic floor health. First, pelvic floor exercises. Practice Kegel exercises twice daily. Contract the same muscle you'd use to stop urination. Hold for 5 seconds. Release. Repeat 15 times. This directly strengthens the bulbospongiosus muscle you're massaging, creating a powerful combination of internal and external support. Second, cardiovascular activity. 30 minutes of walking, cycling, or swimming most days strengthens your entire circulatory system. Better circulation everywhere means better circulation to your pelvic region. Third, hydration. Drink water consistently throughout the day. Proper hydration maintains optimal blood volume and supports every bodily function, including circulation and nerve signaling. Fourth, stress management. Chronic stress constricts blood vessels and suppresses function. Find daily practices that help you decompress. Deep breathing, time in nature, whenever works for you. Fifth, sleep. 7 to 9 hours nightly is non-negotiable. Most cellular repair and testosterone production happens during deep sleep. Without adequate sleep, no technique will produce optimal results. When you combine the massage with these habits, you create comprehensive support for natural function. This technique is safe for most men, but a few important considerations. If you have active infections, hemorrhoids, or skin conditions in the area, wait until they heal before starting. If you're on blood thinners or have bleeding disorders, consult your doctor first, as massage affects circulation. If you experience pain, unusual swelling, or any concerning symptoms, stop and seek medical advice. For the vast majority of men, this is a gentle, natural practice with virtually no risk when done correctly. Here's my final thought. Your body wants to work properly. The systems controlling function are still there. They just need support, maintenance, and the right nutrients. This massage provides all three. It's direct, it's targeted, and it works with your body's natural mechanisms rather than forcing artificial responses. 3 minutes daily, one simple practice. Real. Lasting results. Many men waste time worrying about function when they could spend that same time actively rebuilding it. This technique shifts you from passive worry to active restoration. If this helped you, hit like. Share with someone who needs this. Subscribe for more practical men's health strategies. I'm Dr. Elizabeth Rains. Your body is more capable than you think. Give it the right support, and it will respond. Thanks for watching. I'll see you in the next video.